Welcome to Portal to Health, using the patient portal to support chronic conditions microlearning series, brought to you by the California Telehealth Resource Center. This kicks off session 5, Portal Adoption Strategies. Before we begin, we want to note that this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during this webinar series.
The California Telehealth Resource Center, or CTRC, was established in 2006 to share unbiased, no-cost digital health resources and consultative services with providers and patients located across all 58 California counties and beyond. As part of a collaboration of 12 regional and 2 national telehealth resource centers, CTRC is committed to implementing digital health programs for rural and underserved communities. CTRC became part of OCHIN in 2017, and together they reflect 25 years of practice-based solutions expertise. OCHIN supports safety net health organizations and serves over 6 million patients in 49 states. The OCHIN Health Center Controlled Network, or HCCN, the largest HCCN in the nation. Health Center Controlled Networks are collaborative groups that provide no-cost, on-demand resources and training to participating health centers to address operational and clinical challenges related to health information technology. This is very much akin to CTRC and other telehealth resource networks. OCHIN HCCN supports over 100 participating health centers using a variety of electronic health records and serving over 4 million patients, and it's funded by HRSA. We welcome you to check out the OCHIN HCCN webpage to learn more.
Right. And who are we? My name is Angie Brown. I'm a learning content designer, and I'm joined by Lourdes or Lulu Gonzalez, a fellow and wonderful learning content designer. So before we jump in, here is a full list of all the micro learnings in this series. Each session is designed to deliver quick learnings on a specific focus that can be applied to your patient portal and disease management strategies. These sessions can be viewed in order for a comprehensive overview or as needed for targeted learning. So with that, welcome to Microlearning 5, Portal Adoption Strategies. In this session, we're going to cover some approaches to increase staff engagement, campaign tactics, and sustainable digital health practices.
And enter quality improvement. QI can allow you to think systematically and test small changes before committing to bigger ones. The model for improvement is a really great starting point. It has 3 questions to guide your improvement initiative, and we have an example on this slide. These questions can be addressed in order or are iterative, and as a team moves forward with a change or between PDSA cycles, they should be moving between these questions and adjusting or reframing. So, question number 1, what are we trying to accomplish? This is a really big question. What's really driving the need for change? And this is where you develop an aim statement. The second question, what is the ultimate outcome we need to see as a result of our improvement work? This fits well with developing outcome, process, and balance measures. And then 3, what steps do we need to take to get there? This is your actual plan for change, which can be tested and scaled. And one tactic you can try is patient portal adoption campaigns. Strong messaging and visual design can really generate curiosity and excitement about the patient portal. Try to use concise language, clear instructions, and directly speak to the benefits of the portal. Ideally, a patient portal campaign will utilize multiple communication channels. This could include visuals such as posters, flyers, button magnets, pens, or staff lanyards. Audio such as recorded hold messages. Print such as billing statements, visit summaries, patient handouts, and appointment reminder cards. And also digital materials that are posted on waiting room TVs, the clinic website, or even screensavers in the exam room, or email or text communications. And have those patient-facing materials on hand, like a patient portal feature map, how-tos, or step-by-step instructions. And don't forget to keep momentum going for staff by tracking goals and communicating progress.
Okay, so relatedly, when talking about the portal with patients, selecting certain language or framing can really help patients visualize experiencing the portal's benefits. This can be more effective than listing features or functionality. So, for example, rather than saying messaging is available, let patients know that they can send non-urgent communications to their care teams at their convenience when things are fresh on their mind. Or with the portal, you can spend less time on your phone trying to request prescription refills, changing demographic information, or requesting appointments. All things you can do at the press of your fingertips on your phone rather than talking. So, one thing to consider is having an official kickoff, which can mark the beginning of your organization-wide effort. This is an opportunity to articulate your focus to staff, clarify roles and responsibilities, and acknowledge challenges or barriers. Staff can then be prepared for the road ahead.
We also want to make the portal the standard. So another tactic for patient adoption is to treat the patient portal as a standard for your clinic. This doesn't mean that other communication channels are not available, of course, but can really unify messaging and promote uptake. These are opportunities surrounding the patient encounter to mention the portal for those who have not signed up. So you can do this before appointment scheduling or check-ins, during your encounter with patients, so during rooming or an exam, and then after the encounter during checkout. And when talking about tests or imaging results, let patients know that the portal is the default mode of communication unless a different mode is warranted. And like with the campaign, consider a soft reminder about the portal and appointment cards, visit summary printouts, and other communications. And scripting can also easily fit into your workflows, so reinforce desired organizational norms and create uniform messaging. And concentrate on key roles at first, including call center, front desk, and clinical support staff. Call centers often field questions about scheduling, non-urgent questions, and medication refills, and all of those topics feed into the patient portal. When a new patient reaches the call center and requests an appointment, the operator can offer to send them an activation link so they can easily recall the appointment time and date. For the front desk and clinical support staff, their face-to-face interactions with patients make them critical roles. Front desk staff can emphasize tracking future visits upon check-in and check-out. And that may sound like, thanks for coming in today. Your visit summary will be available on the patient portal. Would you like to sign up before you head out? And during rooming, clinical support staff may say, your immunization schedule and test results from today's visit will be available on the patient portal. I see you haven't signed up yet. We can get you signed up for now if you like. Consider change management principles like including representative staff in the development of those scripts, offering training and practice sessions, and creating gentle reminders that use appropriate framing while talking with patients.
So, after years of working with members here at Ocean on portal adoption, we have learned that there are two time-tested tips that can really make a huge difference. Offer all patients the opportunity to sign up for the portal, regardless of age, background, or other presumed barriers. Some studies find that older adults engage with the portal at higher rates than younger adults. And we also have data that those with lower socioeconomic status tend to use their phones to access the portal more often than other groups. And then, secondly, we all know that there is high trust in our care teams, especially doctors and physicians. So, having your physician tell you that they too use the portal to communicate with their own healthcare care teams can encourage patients to give it a try. And of course, there are some back of the house tactics that can boost patient portal adoption as well. Oftentimes, care teams and clinic staff respond well to friendly competition, and this could look like contests between clinic locations, departments, or even individual care teams. Reporting out results can spur motivation and sustain your progress. Consider using a leaderboard for staff to easily track performance. For those who come out successful, consider offering simple prizes like a casual dress day or office themed day of choice, a certificate, or just some bragging rights. But it is important to set these friendly competitions up with achievable goals based on your population baseline and characteristics.
Yes, and if instant activation is available through your EHR portal vendor, this feature can really boost enrollment with little staff effort when it's couched with persuasive reasons to consider using the portal. This usually works by sending an automated activation text triggered by a certain patient activity. This small but effective tactic also can yield strong results. Make sure that your portal is easily accessible from your clinic website and include an activation request process. There are some basic web design strategies to keep in mind here, such as using the upper right corner, which is where users often look for calls to action, adding a key benefit to this area to encourage use, such as available 24/7, and emphasize the self-service functionality that helps patients while freeing up staff time.
So all of this would be for naught if your staff does not feel bought into the portal. So our first session of this series, we had some tips for this as well, but just sharing the benefits with patients can help them sign up. Emphasizing the benefits for staff can really rally your team to increase adoption. This may be because the portal can mean less phone calls, reduced administrative burden, and less time completing some screeners or questionnaires during a visit. This information can be presented to staff at lunch and learns, staff meetings, or through infographics and flyers. As crucial staff for patient portal adoption, providers will likely need specialized messaging to help promote the portal. Encouraging clinic leadership and providers to sign up for the portal themselves if they haven't already can demonstrate support and expand familiarity. Let providers know that policies and procedures will be in place to manage messages, and try to reach all your providers by acknowledging worries and rolling out efforts slowly. This is important because worries about message volume can really undercut support. And remember to educate providers about using clinical pools and message triage. Consider giving providers one visit per day initially, and then consider allocating part of the provider's admin time to patient portal message response.
And with that, we're ending today's session with some key takeaways. So today we've learned that successful portal adoption relies on coordinated communication strategies across visual, audio, print, and digital channels that is paired with clear messaging. We also learned that adoption efforts are more effective when staff and providers are actively involved through scripting, training, friendly competition, and leadership-led initiatives that address concerns and clarify roles. And what's next? In Microlearning 6, we'll talk through portal features to support chronic condition management. And we'll learn about key features and how to bundle them to drive patient engagement and improve self-management. So join us for Microlearning 6.
All right, and thank you to HRSA for supporting this content. For ongoing support, make sure to check out our website at caltrc.org, where you can find events, webinars, and on-demand resources, and more. And then reach out to us directly if you need at caltrc@ocean.org.
And finally, don't forget to sign up for the CTRC newsletter. Thank you for joining us.